Amid its protests over the government's measures to expand the number of medical schools and doctors, the Korean Medical Association has agreed to hold talks with the Ministry of Health and Welfare later this afternoon. But with the resurgence of COVID-19 infections across the nation, it could take a considerable amount of time before they can reach a solid resolution. Our Seung-jae explains.
The nation's medical community and the government have been clashing over the latter's decision to increase the number of doctors, as well as plans to open more medical schools. However, the Korean Medical Association on Tuesday sent an official letter to the Ministry of Health and Welfare, suggesting they're open to the possibility of talks to discuss such issues, as well as countermeasures for the COVID-19 crisis. The decision comes as the KMA last week announced its third strike planned for this Friday. The Health Ministry welcomed the association's proposal for dialogue and has agreed to consult as soon as possible so that dialogue can begin within the week. If talks do happen, this week's walkout is expected to be postponed. Currently, there are 4 major issues at hand in which the two sides are expected to cover during the talks. These are the expansion of medical school quotas, the establishment of public medical schools, wages, and the use of telemedicine. The Health Ministry says it's open to discuss all of the issues with the association, but stressed that with a shortage of medical facilities and staff in other regions, the demand for future medical science must be met. While the talks are expected to last weeks or months, they're likely to prevent planned strikes, which could have hampered the medical service that's in dire need with the latest resurgence of COVID-19. Seung-jae, Arirang News.